More than 10% of new leprosy patients detected each year in Ivory Coast are children. The disease remains highly endemic in the country, and now an institute is at the forefront of the treatment of leprosy patients and neglected tropical diseases. Leprosy, also known as Hansen's disease, has haunted humanity for at least 4,000 years, often affecting the world's poorest communities. Here's a report from Abidjan about a village which is a new haven for the ostracized communities. Watch.
It is considered a neglected tropical disease by the World Health Organization and remains under research and very little discussed compared to many other illnesses. Leprosy, the so-called poor man's disease. This village, Duquesne-Cremone, in the north of Abidjan, is named after a French priest and an Italian town whose residents financed its creation, and has been a refuge since the 1960s for leprosy patients and their relatives facing social exclusion. Kamel Kouassi, the village chief, says that the patients feel at home when they are brought in here.
In fact, we feel at home here, because the Raoul Falroy Institute, where we come from, was just to treat us. But when we go back home, it's not always easy to be accepted. But when we are in Duquesne-Cremone, we have the impression of having found a new village. But it is a village where we want to live, because we help each other, we get along, we are experiencing the same thing.
Even before the pandemic, the official numbers did not reflect the reality. This in part because the disease's incubation period can last up to 20 years. Testing and diagnosis also takes time, during which patients could potentially infect their family members.
When the disease is not detected early, complications can happen and the complications become chronic. This early onset, which will be amplified by the stigma, is what will create a depressive syndrome.
In the mid-80s, a combination of drugs, including dapsone, known as multi-drug therapy, became available. It can cure leprosy over an 11-month course, though nerve damage and other remnants of the disease remain. The Center for Immunology and Infectious Diseases in France is evaluating whether every new antibiotic developed for other illnesses could also be used for leprosy. They're also trying to find a way to simplify treatment so it can take less than 6 months. There are a couple of vaccines being developed, though they remain in early phases of human testing. Doctors at this facility always have to endure the hard bit of enlisting the patients.
Duquesne-Cremone is everything to me, and we who were born here are not necessarily of the same ethnicity. It is leprosy that brought us together, and so we are a family. And when we get together, we are very happy, unlike in my home village.
In comparison to how swiftly the world responded to COVID-19, leprosy efforts are a drop in the bucket. Scientists say that there is something everyone can do for the victims. Stop using the word leper, as it is considered discriminatory. Doctors say it's a little step that most people can do to give people affected by leprosy the dignity they deserve. Bureau Report, WION World is One.